Hi, I'm Rigupar, Faculty of Nursing, Assam Downtown University. So today I'll be talking on the topic intravenous cannulation. Intravenous cannulation is the process by which a small plastic tube, or what we call a cannula, is inserted into the peripheral veins of the patients. So this is its use for the administration of fluid or any medication or nutrition to the patient, or in case blood sample which can be obtained from the cannula. Cannulation, the indication, fluid and electrolyte replacement, administration of medicines, administration of blood or blood product, administration of total parenteral nutrition in case of hemodynamic monitoring and when we in need of blood sampling. Cannulation articles which needed for cannulation: a dressing tray, a non-sterile gloves, cleaning wipes, Cosby's IV cannula. That is, we need a separate size, so we need to choose a selected appropriate size for the patient, it depending on the requirement of the patient or indication for the patient. Dressing to secure cannula, alcohol wipes, saline flush and saline syringe or sharpen. Preparation. So we need to consult with the patient, give explanation, gain consent from the patient, position the patient appropriately and identify the non-dominant hands or arms of the patient. We need to support the arm and below of the patient in order suitable manner. We need to check for any contraindication, for example, if there is any presence of fistula or any infection or other damaged tissues which is present in the hand or arms of the patient. And encourage venous filling by correctly applying a tourniquet. A tourniquet should be applied to the patient upper arms. So the tourniquet is applied at a pressure which is high enough to impede venous distension but not to restrict the arterial flow. Now we need to opening and closing the fist. Ask the patient to open and close the fist and lowering the limb below the heart. Now the site this is the site of the hand which can be used for giving IV cannula of the patient. In the procedure, before starting the procedure, we need to wash the hands, preparing for the equipment needed for IV cannulation. Remove the cannula from the packet and check all the parts are operational. Then loosen the white cap and gently replace it. Then we need to apply a tourniquet, identify the veins, clean the side over the veins with alcohol wipe and allow it to dry. Now remove the tourniquet if not be able to proceed. Put on sterile gloves and again reapply the tourniquet 7 to 10 centimeters above the side. Remove the protective sleeve from the needle, taking care not to touch it at any time. Hold the cannula in a dominant hand. Stretch the skin over the vein of the patient with your non-dominant hands. Now we need to insert the needle, that is the bevel side up, at an angle of 10 to 30 to the skin. This will depend on the type or the depth of the veins. Now lower the cannula slightly to ensure it enters the lumen and does not puncture the extra wall of the vessels. Now gently advance the cannula over the needle, withdrawing the guide, noting the secondary flashback along with the cannula. Release the tourniquet and apply gently the pressure over the veins beyond the cannula. Remove the white cap from the cannula. Remove the needle from the cannula and dispose it into a sharp container. Attach the white lock cap. Secure the cannula with an appropriate dressing. Flush the cannula with 2 to 5 ml or 0.9% of sodium chloride and attach an IV giving set. Now documentation of the procedure, we need to document the date and time of insertion, the site of insertion, the veins and arms in the hand of the patient, type and course of cannula, the types and amount of IV fluid in case you are going to administer IV fluid, reason for IV therapy, Any problems encountered during the IV cannulation, review the date, because in some hospital policies the IV cannula should not be longer more than 72 hours. After that, we need to thank the patient, clean up, dispose of the dustbin, and send the articles to utility room. Now, complication that occurs due to IV cannulation, it can be IV site infection. This mainly due to this is most common in the related to IV cannulation. Now, cellulitis, when there's a warm red and often tender skin around the site of IV cannulation. Infiltration or tissue that occurs when the infusion or the fluid it leaks into the surrounding of the tissues. Thrombolysis, thrombolism or thrombophlebitis, that it occurs when a small blood it becomes detached from the sheath of the cannula or the vessel wall. Extravasation is the accidental administration of IV fluid into the surrounding tissues. And bruising commonly results from failed IV placement. Air embolism, it occurs when the air it enters into the infusion line. Although this is very rare, that's why before giving the IV fluid to the patient, we need to flush the air before giving to the patient. Hematoma, it occurs when the blood it leaks out of the infusion site. And phlebitis is common in IV therapy, and it can be caused in many ways. It is the inflammation of the veins. Dear friends,